Hello everyone, I'm Dr. Rajka Tharath and today I shall be discussing the importance of the mouth-body connection, how to combat a dry mouth and denture care. While strong and sturdy teeth are the stars of a healthy mouth, they cannot perform well without a strong supporting cast, that is the periodontium, and involves the gums, the supporting jawbone, as well as the soft tissues lining the mouth. Research shows that 25% of adults in the age group of 65 to 75 years have some form of periodontal disease, which is characterized by receding gums, loose teeth, as well as loss of jawbone. Periodontal disease begins when plaque and bacteria start collecting in the shallow trough between the gum line and the tooth. Age itself is not a cause, but the disease can progress slowly but surely over the years if left untreated and undetected, and lead to severe problems in the 7th decade of life and beyond. Treatment involves a combination of scaling, antibiotics, and even surgery in advanced cases. Just like an infected cut on your finger can introduce bacteria into the bloodstream, the infection from your gum disease can also spread. Scientists postulate that bacteria from these oral infections can travel through the bloodstream and trigger infection and inflammation in distant organs and tissues, thus implicating a link between oral infections and chronic conditions like diabetes, heart disease, stroke, and respiratory diseases, which are more prevalent in the later half of the life. Periodontal disease has a bidirectional relationship with diabetes with regards to cause and effect. The inflammation in oral infection can increase the body's resistance to insulin, thus making it more difficult to control the blood sugar. Conversely, years of uncontrolled blood sugar can damage the blood vessels supplying the gums, which can accelerate gum disease. And also, the high sugar in the blood can act as a nutrient source to the oral bacteria. Thus, the well-being of your aging mouth is tied to the well-being of the rest of your body. If you notice that your gums are bleeding while brushing, it's a sign that your oral hygiene is not ideal. Nevertheless, keep on brushing as things have to get worse before they can get better. Once the inflammation reduces, the bleeding will also reduce and eventually stop. However, if you stop cleaning the plaque between the teeth, the problems as well as the plaque will return. Interdental toothbrushes, which look like small tube brushes, are a good alternative to flossing. Water flossers are another good option, as well as sonic electric toothbrushes, which vibrate the plaque of your teeth. Aging is associated with more health issues, which means multiple medications, and most medications list xerostomia or dry mouth as one of the side effects. Lack of saliva is just not being merely uncomfortable, but it also causes extreme difficulty in eating and swallowing. It also leads to bad breath and causes inflammation and infection of the oral tissues, especially if you are wearing a denture. It can also increase the susceptibility to gum infection as well as dental decay. In fact, caries is known to form within as less as 3 months once dry mouth sets in. So what can you do to combat dry mouth? Simply sipping water more frequently through the course of the day can help. Try to hold the water for a few seconds in your mouth before swallowing. You can also try chewing on sugar-free gum, especially the one which contains xylitol, as research has shown that xylitol reduces the bacterial load in the mouth as well as stimulates more saliva production. Also, you can suck on sugarless candy as well. Try to drink alcohol and caffeinated beverages in moderation, as these can dry out the mouth. Tobacco can also dry out the mouth, and you can chalk this as one more reason to avoid tobacco apart from the 100 others. Even though not exact, but over-the-counter artificial saliva products can help to keep the mouth moist, as they contain ingredients which closely mimic the saliva. In case of dry mouth, you must also meticulously brush and floss your teeth in order to reduce the risk of gum disease as well as tooth decay. You can speak with your physician regarding the medications which have dry mouth as a side effect. Even altering the dose or trying out a new medication can help certain conditions. Don't forget that your saliva is the best natural antibacterial mouthwash, and it prevents the buildup of both plaque and bacteria on your teeth. So moving on to denture care, today I shall be discussing the care, cleaning and maintenance of dentures as well as the denture bearing mouth. Dentures are artificial replacements of natural teeth and come in two forms, that is partial and complete. It's simply important for you to understand that dentures are brittle and are prone to breakages if they fall down. So even before cleaning the denture, make sure to fill the sink with water or place a folded towel below it. Even while storing a denture, make sure to use a container with a lid in order to avoid breakages due to accidental spillage. You should remove the denture every night before sleeping, while using a mouthwash, and when denture use causes pain or irritation. Denture adhesives are used by people to prevent slippages of the dentures, but some dental professionals feel that continuous use can cause a buildup between the gums and the denture, which will eventually lead to the shrinkage of gums and loss of jawbone. However, there's a large majority of people who still use denture adhesives, and if you are one of them, this information is for you. If you have trouble removing the dentures, here's a simple trick. Fill your mouth with warm water and then swish to loosen. You might have to swish a few times to loosen the dentures. Once the dentures are out, it's extremely important to clean both your mouth as well as the dentures. In order to clean your mouth, use lots of warm water and brush it out with toothpaste. For cleaning the denture, put the denture in icy cold water until the adhesive hardens, and you can simply pluck it out then. Now moving on to the cleaning of your dentures. Make sure to rinse your dentures after every meal with water to remove debris from food. When you remove them at night, soak them in a solution of water and a denture cleansing tablet. This solution will help to soften the plaque buildup as well as stains. Make sure that the water is at room temperature, not hot, as hot water can change the dimensions of your denture. In the morning, brush off the softened residue with a denture cleansing brush. Do not use toothpaste, as toothpaste can be harsh on acrylic dentures and cause microscopic cracks in the long run. It is also not necessary to buy all the denture care products that are advertised as essential. There are inexpensive options available, and you can even make them yourselves. For example, instead of a denture cleansing brush, you can use a fingernail brush or even a soft toothbrush. Instead of a denture cleansing tablet, you can use a solution of white distilled vinegar and water in the ratio of 1:9, that is 1 part of vinegar and 9 parts of water. Do not use vinegar while cleaning partial dentures with metal attachments, as it might tarnish and corrode them. For their care and maintenance, you must take special instructions from your oral healthcare providers. Salt and baking soda are two brilliant natural cleansers, and on combining them with glycerine, you can have your own safe, gentle and effective paste for cleaning dentures. Just make sure that the salt is finely ground. You can also add a flavoring agent like mint or any other preferred flavor. Another method is to simply brush your dentures with an antibacterial hand soap or a dishwashing liquid and water. So after cleaning comes disinfection. Brushing your dentures cleans them but does not disinfect them, and acrylic dentures are porous materials and therefore breeding grounds for a large number of bacteria and microorganisms. You can disinfect your dentures by using denture bleach, which is commercially available. Do not confuse it with household bleach. You can use it in the ratio of 1:10, that is 1 part of bleach and 9 parts of water, or you can follow the manufacturer's instructions. But do not use more than what is recommended, as it can discolor the pink portion of your dentures. You can also use vinegar in the ratio of 1:1, that is 1 part of vinegar and 1 part of water, 50% vinegar, 50% water. Microwave irradiation is also an alternative method recommended to disinfect dentures. Make sure that the procedure is carried out in a dry environment and for a maximum of 3 disinfection cycles. The parameters for optimal disinfection and minimal dimensional change include 650 watt power for 3 minutes. And when you have nothing, you have the free air around you. A lot of people are not aware of the fact that oxygen can kill yeast and a lot of other bacteria. So you can place your denture outside your mouth on a clean dry surface for a couple of hours. Just remember to soak the denture in water for half an hour before putting it back in your mouth. In case of a broken denture, trying to fix it yourself at home can be dangerous for the denture as well as your mouth. Using a do-it-yourself repair kit can damage a denture beyond repair. So just call your dental office and I'm sure they'll find a way to help you out. Apart from caring for your dentures, you also need to look after your mouth. You will notice that if you do not look after your gums, they can actually affect the fit of your dentures. Poor oral hygiene is known to cause denture stomatitis as well as fungal infections like candidiasis, which cause pain and inflammation in the denture-bearing tissues. In order to avoid all this, make sure to brush your gums, tongue as well as the roof of your mouth every day with a soft bristle toothbrush. This will also help to stimulate them. Try to get into a habit of rinsing your mouth with warm saline water before placing the dentures in your mouth every day and after removing them at night. Peppermint and spearmint teas can also act as good natural mouthwashes. Boiled sage leaves are known to have soothing effects on irritated and inflamed gums. If you have yeast infection, you can coat your gums with a thin layer of aloe vera gel and also grapeseed oil as well as grapeseed fruit extract are known natural remedies. A healthy smile looks great at any age, and so the effort that you put in is totally worth it. Stay tuned for more information on dentinal hypersensitivity, oral cancer and lots more for seniors in my next video. In the meantime, keep smiling and namaste.